So welcome to our Q3 2025 webinar. We've got Dr. Brandon Crosdale here this evening, and he is going to talk to us about lifestyle medicine and physical therapy. I would love, Brandon, before I screen share the information, and you may tell me to wait, we're going to get to this, but I would love to hear, like, what are your certifications that you got that kind of, make you an authority on this so that we can just kind of know where you're coming from.
I literally just came off the street. I don't know anything. Um,
You wouldn't be the first, I assure you.
um, so obviously a physical therapist. I recently, I guess within the last 2 years, got my OCS. I got my therapeutic pain specialty through the International Spine and Pain Institute through Adrian Lowe. And I guess the most recent thing, personal trainer as well. And then the most recent thing would be the certification or certified health professional through the American College of Lifestyle Medicine. And I guess what makes me qualified to talk about this is because I try to live a lot of the things that ACLM talks about or tries to preach, and then without being overbearing, just try to sprinkle them into what we do already as physical therapists.
That's really cool. I can't wait to hear what some of those things are, which I am thinking you're going to go through in this presentation. So I'll go ahead and get it pulled up for us and we can go through.
Awesome.
All right. Can y'all see that screen? Okay.
Mhm.
Awesome.
So, so I chose this topic because Erica already chose pain science, and also the other reason was because I went through a lot of big, scary health issues during the pandemic. High blood pressure runs in my family. I had a lot of chronic pain, and I wanted to change my lifestyle, and I just didn't know how. So through a lot of research and practice, I ended up learning about lifestyle medicine and how it could transform my life without necessarily needing a whole bunch of just conventional medicine, if that makes sense.
Oh, cool.
I'm sure
Yeah.
I'm sure everybody's been through their own types of transformations, right?
Hmm. For
Yes.
sure. Yes, sir.
Okay. So objectives, they're pretty clear right there, but essentially what we're going to do is I'm going to tell you what lifestyle medicine is, um, where did it come from, like how did it all start, and then compare the lifestyle medicine to conventional care, how it's maybe different, how's it different maybe from like functional medicine, what that core coaching approach is, and we're going to practice and discuss that a little bit. And we're going to see how we can take some of the things from this presentation, maybe stuff that we're already doing, and bring it back to physical therapy. Okay, this slide is long because it's a vignette, and we need to paint the picture for the type of client that I typically will see and the type of um, client that you all might be seeing in the clinic, and understanding how we can take the things that we already know and apply to this patient, right? And then afterwards, after I go through my presentation, we'll come back to this client and see if there's anything more that we can add that we didn't already discuss. So, 42-year-old male in tech. I see a lot of people from the Apple campus because I'm still a personal trainer there, right? And typically they're coming in with some kind of pain. I chose low back pain in this particular case. No red flag items. Has tried PT, has gone through sort of the mill of PT, but only saw short-term relief. This says that they had a score of 38% on their ODI. That's moderate disability right there. And then pain or PCS or pain catastrophizing scale of 40 out of 52. For those that don't know, I believe anything above 30 is can indicate high catastrophization. Their typical lifestyle. Uh, Essentially, this slide means they work a lot, they sleep very little, they don't exercise, they have a high stress job where they have to be on for like the iPhone 17 just came out. So these clients that I typically will see are working up until 2 or 3 o'clock in the morning because they have to make sure that they're available for China or some of these other things, right? And they're eating very poorly, and they don't have a lot of time to socialize. It's just the work and then maybe their family and then whatever it is. But they do want to not be in this pain anymore. Oftentimes they're dissociating, right? Where they're in this sort of fight or flight response and they're not necessarily treating themselves. They're just trying to fix the problem in front of them. And then sometimes they might have some latent pain or latent symptoms that come on afterwards. Yeah. So now that I've painted this picture, um, what would you all do with this patient? And I can be even more specific. What if this patient were to come to your office? Um, what would be some things that you would want to assess, and then what would be some possible treatments for this person?
Well, these are my favorite patients, not with this much stress, but with spine. And so, of course, medical history, lumbar. We do with NIOP training, we do what's called a lumbar scan exam, where we're looking at range of motion, neurological signs, myotomes, dermatomes, reflexes, and then assuming that there are no red flags within that, going straight into um, joint, like individual joint, passive and accessory intervertebral motion. And yeah, I'm just trying to figure out where that big pain generator is.
I love that. I think that I would definitely delve into like postural and work setup too. Like I know Brandon, you're big on ergonomics. I always look at that like holistically and then like core control because a lot of times with these people they're really like hunched over and their core is very weak. So I'll often look at that as well and just see kind of what their posture looks like grossly when they don't know and then what they kind of reframe to me of like what their setup is like so that like yes, I can give them exercises and work on them in session, but like what can we do for those hours on end when they're up till 2 in the morning, that's going to help with the carryover.
Yeah.
I have a little bit of a different perspective. I would probably first dive more into like what their perceived barriers are, like what's getting in the way in their mind for them doing anything about their pain, and if they were to start trying to do something, what would they feel capable of doing? Just to get really good goal setting and a good more idea, especially with this increasing with stress and deadlines connection, just with how their chronic pain might be impacting their perspective of their healing.
Okay. And then if so, following more up with that, Erica. So how would you necessarily, if you did find something that you could treat, how would you treat it?
Yeah, I guess it would depend on what they said their berries were. Like I would make whatever I would give them for treatment or their HEP or whatever off the bat, it would be the thing that has the least barriers to it, or to them. So that's why I would ask that question. But just doing super simple HEP of whatever they feel like they could get started with. So whether that would be, just like basic mindfulness or some body scanning, or if they feel like they could do some of the exercises that would be beneficial when we look at their objective stuff, we could start right away with that. But it would be anything that's going to help them build confidence.
That's
Cool.
really good.
That's
Yeah.
fascinating. They're all so different.
I love that. If only we could all be in that one room at the same time, we could really do some damage.
Yeah.
Right.
We can figure this out.
Tria.
Okay. Next slide, please. Okay. What is lifestyle medicine? English. Evidence-based practice that involves lifestyle interventions. The lifestyle interventions are listed below, but you're doing these lifestyle interventions and then also using the best evidence medically or conventionally to also treat this person, right? And oftentimes when you're doing these lifestyle interventions, you're trying to help treat the sort of chronic condition, prevent it, or oftentimes, or in some cases, reverse it, right? So you can think of, yes, there are people that have been able to reverse diabetes. There are people that have been able to put their high blood pressure into remission through lifestyle changes. There are people that have been able to reverse heart disease so that there is no or almost no point of occlusion for arteriosclerosis through lifestyle changes. So I'm just going to go through these pillars really quick. So nutrition, when they talk about nutrition, from an evidence-based point, they mean whole foods, mostly category one or class one type foods are whole foods, mostly unprocessed plant-based foods. It's not saying you have to be vegan or you have to be 100% plant-based, but it's saying that these foods, in terms of like their nutrient quality, right? These will tend to be the thing that is going to be more nutritious, and it can be consumed with other products as well. Like this should be the majority of your diet for recovery and other stuff like that, right? They use physical activity instead of, they also use exercise, but they like the word physical activity to denote that it's not some kind of like scheduled exercise. The American College of Sports Medicine recommends about 150 minutes per week, maybe around 3 sessions of weight training and 2 sessions of cardiovascular training. But the best type of exercise we find, or hopefully that we find with most of our clients, is the type of exercise or physical activity that they will do, in my opinion. So they say sleep here, but we're really talking about restorative sleep. As we saw with the previous client or the vignette, they were getting about 5 hours of sleep. And we know anything less than 7, for the majority of the population, from Matt Walker and other people that are experts in the field for sleep, we know that's when all the big, bad, scary stuff happens. Increased risk of impotence, increased risk of Alzheimer's, increased more likely to die of a heart attack. Like really bad stuff starts to happen when you start to sleep less than 7 hours. And then it's not like a credit card where you can just like swipe it and pay it back. You can't really pay back that sleep, right? Stress. You can have eustress or malstress, right? We want to be somewhere sort of in the middle, right? And you're just like, Brandon, what, like, if you have little stress, what does that necessarily mean, right? That means that you can be unmotivated to do things. Like, if you don't have enough stress, you can be unmotivated to do things, and then you could be depressed, or you could feel as though you don't have fulfillment in your life. If you have too much stress, you can feel like you're constantly in that sympathetic state, right? Or parasympathetic, sympathetic, somewhere maybe even between those two, right? You want to have a good balance of your stress, because that can also trigger more chronic disease. We have research to suggest that even if you have a perfectly normal coronary artery, acute stress events can bring on heart attack-like symptoms.
So Brandon, I'm curious just because like I feel like a lot of us are often on that higher end too, just with all the things that we're juggling in life. What are some like things or outlets that you would recommend specifically on the stress realm to patients?
We'll get more into it later,
Okay.
but there is, has anybody, I guess, let me ask this question. Has anybody heard of uh, MBSR,
No.
mind body stress reduction?
No.
I
No.
have a little bit, yeah.
Yeah, it's pretty similar to PRT,
Yeah.
in the sense
Heard of
that
that one.
it's, yeah, in the sense that it's, so MBSR has been around for a very long time. It's very researched, right? Just like cognitive behavioral theory, behavioral treatment, sorry. But it talks a lot about, as Erica talked about before, it talks a lot about mindfulness and and body scanning and ways to observe what is happening inquisitively, and to sort of scan the body and try to relax it. I believe, and I do use PRT as well, but PRT tends to focus more on trying to reduce specifically pain through observation. And MBSR can be used for multiple things when it comes to the whole body in terms of stress. And as I said before, highly researched, very effective for treating chronic conditions like our person that we saw before. You were asking what we could do. There are plenty of apps, right? I've tried to look into getting certified for this. It's terribly expensive, and essentially, it's the idea is that you just want to be more mindful of what's going on. So meditation, Headspace. There are many different apps that you can use to create said mindfulness to help reduce stress over time, right? Journaling. Yeah.
Thank you.
Any other questions? Erica's shaking her head and smirking. I wonder, do you have
I
some
was just
other things?
thinking, so it's not a question. I was just going to say for stress, along that mindfulness-based stress reduction, one thing I will do is I made my own playlist in YouTube of body scan mindfulness guides that are like less than 10 minutes. And oftentimes if I have a client or a patient who is stressed and having a hard time with sleep, especially, I'll recommend just doing a 10-minute body scan video, which is exactly what Brandon talked about, and doing that right before sleep. And most of my patients will report that they're like asleep before the video is even over.
What
And it's
even
a
is that?
really, yeah, so body scan, it's really just getting into a comfortable place. It's a form of mindfulness, essentially.
Okay.
And it's just bringing your awareness to your body. And when you listen to the guided scans, it's nice because they'll, like a meditation, they'll guide you and they'll say, they'll prompt you to like pay attention to how your forehead is feeling, and then how your jaw is feeling, and how your neck and your shoulders. And it just kind of helps you scan your body, and it allows you to just take a second to breathe and check in with where you're feeling tension, and then let all of that go. And that is a really good way to get out of your head and more into your body and go to sleep. So I just want to share that for stress specifically. It's been useful with some of my clients.
That's great. I feel like I have a
Yeah,
lot of patients who like doom scroll. So I'm always trying to like get them to like not doom scroll. So I think this is great.
Yeah.
awesome.
Yeah.
Yeah. Um, I'll get more into it later, but
Okay.
yes to everything that was just said. Social connection. What they're really saying here is positive social connections, not that person that is quote unquote perceived as toxic in your group chat that's always complaining about something. I know I complain a lot, by the way. But
No.
um, but
No, you're
really those people that bring joy to your life, that you can connect with and um, satisfy that sort of primal hunger that we all have to be a part of a community, right? And I oftentimes will tell my patients that our bodies are not designed to thrive; they're designed to keep us safe and survive, right? But through social connection and some of the other pillars of lifestyle medicine, um, having more positive feelings, more positive emotions, positive psychology about an outlook on life can be good because it eventually leads to this thing called eudaimonia, which has any of y'all heard that term before?
A
It's
little
a
bit.
side effect of this, but essentially it's this sort of state of thriving, the state of being where you exist, uh, but you're thriving. You're feeling as though you have a high amount of self-efficacy to go back to the vignette when Erica was talking about like how do we empower other people to feel better, to exist within their own skin and not feel shame.
That's cool.
And then the last one's pretty simple. Avoid risky substances. Don't do cocaine. Try to avoid tobacco and try to reduce alcohol because they're addictive and they mess with our natural endogenous drug box. And then all of these are prescribed by not us, but by different parts of the medical team. So we might take the lead on something like physical activity or exercise, right? And maybe educate about sleep, express a little bit of nutrition when it comes to recovery, or if somebody is experiencing longer episodes of pain than usual, right? And we prescribe these in a dose response like manner. Anybody familiar with what the FIT principle is?
No, I was wanting to hear that.
Anybody?
Frequency, intensity, time, and type, right? If I
Mhm.
Yep.
remember.
Oh,
Yes. This one's I think it first came out of the American College of Sports Medicine. This is essentially how you can prescribe exercise. So frequency, how often? Oh, you're gonna do Mr. Smith, you're gonna do this 3 times a week. And don't forget to do it because I'll know when you come back on Monday, right? Intensity, how hard it is. If you're in the gym, Shania, it's your RPE, it's your reps in reserve, it's your 60 to 70% of 1 rep max, right? Erica, for you, it might be time that you are prescribing walking for said patient. So let's start off with 10 to 20 minutes because in the research, we know that has a calming effect on the nerves. And then, Kelly, for you, it might be the T is type, right? What type of exercise are we doing for those student athletes that you're treating, right? Are we doing walking? Are we having you do slam dunks? Are we having you do sprints? And then, yeah.
hmm. Love it.
So next slide. So here's the history. I know this slide is very brief, but I met that guy back in 2023 in the bathroom when I was in one of
Ah!
the urinals, and not to be gross, but I was just like, I'm so sorry, but are you so and so, Dean Orrish, Dr. Dean Orrish? And he's like, yes, I am. I was just like, well, your work has changed my life. Like I'm here
That's so
because of you.
nice.
I probably would have died during the pandemic. And he went on and on about this and that, and I was just like, so like, are you going to be speaking soon? He's like, yeah, I'm about to go do the keynote for like thousands of people, right? And I was just like, aren't you the guy that made like or helped Bill Clinton go vegan? He's like, yes, I am. I was like
Wow.
his like medical advisor. So I was
Wow.
like, cool, man. And then he gave the keynote, and it was cool. But he, sweet guy, and I mean sweet as in like he just had like the biggest heart. So when I talked about positive social connections, right? He was taking these people that back in the 70s and 80s that were having these massive heart attacks, should have died, right? And having them go through these intensive lifestyle medicine programs. And they would come out and be like, that heart attack saved my life. Like I could weep by how happy I was to hear him speak. And just like how much he's helped these, and mostly men, these groups of men in these like social circles talk about their feelings and being able to connect through this shared pain or shared trauma, and how they got super better. They had something that happened to them and they got better um, through or post trauma, right? So he was using lifestyle medicine to help essentially reverse, as I said before, the arteriosclerotic coronary artery back in like the 70s or 80s. That was the first example. Um, we had we had many other programs after that. Then in 2002, we had great examples of how lifestyle changes could cut the risk of diabetes by about 58%. Metformin can do that by about 31%. So metformin's like the standard sort of treatment for that, right? The rest of the stuff isn't important. In 2009, the American College of Lifestyle Medicine was formed for certification in 2010s. Next slide.
I do
Yeah.
have a question.
Oh yeah, sure.
So I know you mentioned like Bill Clinton with like the vegan. So in terms of like his Dr. Ornich's kind of philosophy, is he
Yeah.
like solely focused on plant-based or is it just over the holistic lifestyle benefits?
Holistic lifestyle. So
Okay.
it was so he had these groups of men that I say mostly men because that's what he talked about, talk about A, their feelings, and B, have them form some kind of community, right? And that community would help them um, feel more involved, feel more hopeful, help them thrive as they're learning to cope with their new stent or whatever was happening to them at the time, right? It would help reduce their stress. It would help encourage them to do more exercise. So all of the different parts of lifestyle medicine, but um, the Mediterranean diet and plant-based diet have been shown to significantly reverse arteriosclerosis after about a year. So
Wow.
that's why I keep on mentioning that's why I mentioned vegan in this particular case, diet.
Awesome. Thank you.
Of course. Anybody else? What do you all think of that last slide that I just had?
I'm gonna go Google him.
Yeah,
That's what I think. I'm like, wait, let me hear about this guy.
yeah,
I
cool
just
guy.
think like everyone needs to hear this. So I wish we
I
could
do
just
too.
plaster this everywhere. This needs to be an ad. I
Yeah,
just think it's so beneficial. Like even like just hitting close to home with certain family members with certain things lately. I'm like, I need to just feed this to people. So really grateful for you presenting on this today, Brandon.
of course. Thank you all.
Yeah.
Well, and also
Anybody
I
else?
think it's
Yeah,
really interesting that that's not something that I felt like was in my wheelhouse, like was in like will be the right like that I had the would have the authority to help people with, if that makes sense. Like I very much like try to stay like in that lane, but like
yeah,
really when you look at it, like even this next one with pain sensitivity and like the stuff Erica talked about with pain reprocess, I mean it like I sign all my patients up for this website. I'm like, this is fascinating. Like it's just another reason why we have the best profession ever, because we can literally help so many people. And like, gosh, if you added, I'm just like, if I had that on too, goodness gracious, like who would, I dare you to give me someone that would not benefit from it.
Mm-hmm.
yeah. So just so you know, I when I'm treating, which we'll get to later, I tend to stay in my lane when it comes to exercise, sleep, stress. I'm not really handling the positive social connections, but I do touch on it just to see where they're at. Do they have a support system, in other words, right? I
Hmm.
mentioned this, but I also work at contract at another clinic. It's a trauma clinic, and that at that trauma clinic, there are people that I was just there this past weekend, where somebody flew in from St. Louis. They had physical trauma to them in the past. They had abused drugs, and now they help other people avoid those situations, but they had such bad chronic pain that they never addressed because they kept on trying to help everybody in front of them instead of helping themselves, and then feel worthy of these things, right? So I'm not necessarily going to help them process that trauma, right? Even Erica can speak to this, but even for PRT, right? Um, the book, The Way Out by Dr. Gordon, like they talk about needing those patients still needing like psychotherapy, right? To help
Yeah.
them process what's going on. So we're not the ones that are going to be treating all of this, but understanding the whole picture and being a part of that team can really help empower these patients so that we can um, have them create that self-efficacy, that self-determination so that they can make the changes themselves over time.
Yeah, absolutely. I think it's cool too. In the last slide, it sounds like he had a little bit more focus on males and male clients, and I think that is a good thing to keep in mind as PTs too, because often I feel like with women or girls, it's much more connected and easier to talk about some of these lifestyle things and these habits, because for women, it's really seen in social media a lot, and it's often connected to like how they look and all these standards. But men are usually not, that's not something that's really expected of them to talk about those types of things, and their diet and what they're eating, and are they getting enough beauty sleep, right? And like that
Yeah.
type of stuff. So I just think it's good to keep in mind that it might be harder to have these conversations with males, but it's just as important too to be discussing these things with our male clients.
Yeah. Anything else? Anybody? Okay. So why now? Um, 6 in 10 adults have chronic disease. 4 in 10 have two or more different things going on. And a lot of people, according to research, are mostly dying, at least in here in America, from lifestyle related disease, chronic disease, right? They're not eating enough plants. They're not exercising enough. They're smoking too much. They're drinking too much alcohol, too high of stress. They're not, yeah, they're just not taking very good care of themselves, right? And chronic disease accounts for about 90% of the $4 trillion annually that we spend on US healthcare spending, right? So as concierge physical therapists, right, we not only are trying to cater to what this person needs on a physical level, but I dare even say on a human level, because we want to be able to connect with them and form that therapeutic alliance so that they'll seek out care from other providers that are maybe similar that want to help them on their health and wellness journey. So I threw in pain because oftentimes we're helping people understand what pain is and we're treating it, right? But um, not, or sorry, having higher sensitivity to pain can be affected by your sleep, your stress, right? If you're not getting enough sleep, that's going to increase decrease that threshold so that you're might be hyperallergesic, um, or maybe allergenic as well, right? If your stress is high, it's going to also it can increase um, some of these chronic issues that you've been having for a while. And then if you're trying to, how do I want to say it? If you're trying to load tissue, or if you have those patients that they go for a 5 minute walk and then they're in pain the rest of the day, right? Like it's going to be hard for them to believe that they're going to be better if we're not addressing some of the lifestyle things that are going on with them. That makes sense?
Hmm.
Mhm.
Okay. I'm a big Doctor Who fan, so I had to put that up.
Mhm.
So this is sort of conventional care, the expert approach, right? We are the expert when it comes to musculoskeletal issues, right? And this role is very important, especially when it comes to really acute things, right? You've got change in bowel or bladder, you got saddle anesthesia, right? And you're noticing that you're losing motor control. We, as the experts, would say you don't pass the first step for us to decide whether or not you need PT. Those are red flag items. You need to go to the ER. You might have cauda equina syndrome, right? Like you need to get a spinal decompression, right? Or you have difficulty speaking, swallowing, double or blurred vision, feeling you're going to pass out, numbness, tingling, or nausea, all of these things, and they're unexplained with maybe some pain around the trap, then you need to go for a CT with contrast because it might mean that you have some kind of dissection in your artery, or it could be something more insidious, right? So it's important for us to be able to act as the expert and make these decisions quickly, right? And that's how we manage our patients, right? Can we go to the next slide, please?
I do have one question, Brandon. How do you think like horses versus zebras? So like I know you throw those out, but I feel like we're so caught up sometimes in the day to day. Like I get the big red flags really stand out to us, but like when you're bringing up those examples of like referring for CT and things like that, those are mainly just real big red flags. There isn't any like little underlying nuggets or nuances that would kind of prompt you.
I'd explain.
Want to
So I mentioned the big ones,
Yeah. So it's mainly
right?
just like big things. Like you're not like every single person, you're not like, oh no, like, because I always think like too, I feel like sometimes, the analogy of like horses versus zebras, right? Like we're taught in school, like always think it's like horses, right? Because we want to be confident in our skill set. But sometimes the zebras are the ones where we're like, okay, we did refer that one. I know, Kelly, you had an instance lately or recently where you took someone to the ER because they had a heart condition. And like I had someone who I thought had a DVT. We sent him in, but it was ruled out. So like with the arterial cases, those are the ones that are a little bit more I guess, scary and uncertain. So are there any like underlying other things that you have seen minus like big ticket red flags that you would recommend? Like additional
Yeah.
screening for or anything within this lifestyle coaching?
Um, so that's tough. So we're talking about, so with lifestyle medicine, we're mostly talking about chronic conditions, right?
So like
Right?
you're saying like referral for CT, I get that like with some of these other things that you're like they're popping out like red flags, but like it might not be that cut and dry, right? Like so I'm just curious like if you've learned anything that would be like unconventional that would help
Well, you
with.
really were using that just to speak to our authority as
Okay,
experts in
okay,
this
okay.
field,
Yeah.
not to, yeah, yeah.
Okay.
Hmm.
Yeah.
Sorry.
No, it's okay. It's just that typically these patients are not going to need to go to the ER unless there's some kind of like traumatic episode or
Right.
some kind of like psychotic break or like a panic attack, right?
Okay.
Or they have like acute pain. Um, those would require probably ER if we can't pain control them and they're showing other signs of weakness and or maybe signs of some kind of, I guess, physical or mental damage to them, right?
Mm-hmm.
But and then obviously if we're doing our due diligence, right, we're having them do a PHQ-9, I
Mm-hmm.
believe it's called.
Yeah, Park U, yep.
Yeah,
Mm-hmm.
Part Q. And we're
Yep.
we're trying to make sure that in the past month, have you had any symptoms or any feelings of feeling down? In the past month, have you a little interest in doing things? Are you seeking care for it, right? Like we want to make sure that they're not suicidal, right? And if they are suicidal, we would normally just say, hey, hey, do you have a plan? And do you plan on carrying this out? And then we probably would say something like, do you want help with this? Right? Do you want help? Do you want to receive help for this? Right? Because some of those people, especially if they've had trauma before and they're socially isolated, maybe they just never had the opportunity to talk to somebody about some of these things. So I guess that would be more of my tie-in with some of the lifestyle medicine type things. Um, and I can't really make another correlation because a lot of these symptoms, sorry, a lot of these other conditions are more chronic. I'm mentioning
Yeah,
more
that
red
makes
flag.
sense.
Yeah, as Kelly said, I'm just mentioning more red flag items because it is something that's more emergent that you want to be able to make a decision on those very quickly, in case they could be something else, more insidious.
Thank you. Sorry, I didn't mean to like delve in too deep. I was just curious because I know there's a lot of new screening with like lifestyle medicine and like getting certain arteries screened and things like that. So that's kind of where I was going along the lines of that with like preventative care.
No worries at all. And I think it's called the Wells. Are you familiar with the Wells for
Oh yeah.
DVT
Oh yeah.
testing? Yeah. So
Hmm.
we could just use stuff like that in terms of like testing to see or raise suspicion about clots and whatnot.
Hmm.
So lifestyle medicine tends to use more of the coaching approach. So you and the patient or client, right? You're both partners in this, right? So since adopting this, my exam, instead of sitting across the person like this, I sit next to them with a body chart. And I said, you and I are approaching this problem from the same vantage point. Like, if I get something wrong, you have to let me know. Like, we're captain and co-captain, and we're in this together, and we're going to figure what this thing is, right? And by eliminating that barrier, partnering up with them, um, it makes it a little easier for me, at least not everybody has to do this, but it makes it easier for me to see what's going on and I'm not missing things. They're like, no, 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 it's over here. It's more this, circle this, or it's more here on my body, right? And even if it isn't necessarily something that's physically happening to them, like it could be centrally sensitized pain that their neuroanatomy has changed and their ion channels and their nerves are causing them to feel more stressed and temperature changes and be more sensitive to things as their thresholds in said nerves are starting to change because of their chronic pain or cortical smudging, right? Like all of that, right, is super important for us to understand, right? But also, um, it's super important for us to help the patient connect with what's going on to them, and for us to understand how we can maybe help them and give them hope about the thing that we could be treating, right? So from a lifestyle medicine perspective, we partner up with them and we help them build confidence and we help them um, build or create their new life, right? Like it's not just about their back pain, it's about what they can do after they have they've gotten rid of quote unquote their back pain, or it's about what they can do with said back pain, right?
Mm-hmm.
That was a lot of ranting on my part, so
No, it's
I
good.
would
Yeah,
It's
good.
I I would love if you all had any questions about this sort of coaching.
I think on this slide, the last one about reducing or de-escalating meds when appropriate, I think that's a really good one for us to keep in mind as PTs as well, because we oftentimes like don't think about we oftentimes don't think about medication discussions too much with our patients. Like sometimes if we maybe notice something or if something really stands out, but oftentimes we usually just use it as like a review for us just to know what's going on. But kind of going back to what you were asking about before, too, Shania, almost like a yellow flag with these
hmm
types of patients for me is really diving deeper into their medications that they're on. Because oftentimes these can be patients that have been to multiple providers, multiple different healthcare systems, and they could be on like so many different medications that overlap and may not even be necessary. So I think having the knowledge to dive into that too as another healthcare provider that spends a lot of time with them, I think is a really valuable skill as a PT. And checking and making sure, like with someone with vascular stuff, right? If they've got a lot of swelling, pooling in their legs, making sure that they are on a diuretic, right? Because they could be complaining of bilateral lower extremity pain, and maybe someone took them off the diuretic and never put them back on,
hmm
right? So just things like that I think are really cool with the medication from a PT perspective and something we might not think about.
Yeah,
I like that. And
especially
I think like, go ahead.
I was just gonna say, especially since we see them so often.
hmm
Right.
And I think like just like follow-up care too, like meds or no meds, like, hey, are you wearing compressions? Like just like that next level. Like I feel like this whole presentation really sheds light on like our, profession as a whole and like really looking at the whole patient versus just the diagnosis because everything's all intertwined. So I love that, Erica, of like getting into the meds too, because a lot of things like, oh, you're on that, like, oh, maybe it's a DVT. Well, I take aspirin every day. Like certain things that you're like, oh, okay. Well, maybe, horses versus zebras now, like kind of going down the route, like always being overly cautious, but also like looking at the whole picture too in those instances.
Yeah.
Okay, this is essentially talking about how do we coach our patients, right? So we try to collaborate with them. I mentioned that before extensively in the last slide. So we partner with them instead of just telling them exactly what to do, right? We mix both in, right? We want you to do this, right? And then we can ask open, inquisitive questions. Less why and do you, right? Because those will usually result in more close-ended answers, but more like what or how type questions, right? Because then those questions can elicit responses that will allow the client or the patient to express more thoughts about what they're feeling. And then that will enable us to um, better reflect on what's going on in their life, right? So this goes into motivational interviewing, right? Which is asking open-ended questions like Erica described earlier, listening deeply and the little head nods, our body language, right? Because we speak mostly 60% with our body language, right? For me, I oftentimes 6'1", 205 pounds. I make myself smaller if I'm working with somebody with smaller stature and they have a lot of fear or they're afraid of being touched, right? Just those little things that we can do to make them feel more comfortable so that eventually they'll trust us and maybe shift their beliefs a little bit so that we can do what we need to do, right? And then that will also allow us to create these SMART goals or little goals so that we get them 1% better with every interaction, right? And that 1% better means that, especially from a coaching approach, that they're seeing that they're getting better at these things right? And it gives them more confidence, like Erica had described earlier in the presentation.
I like that.
Cool. So um, we've got Erica here as an expert, and y'all are pain science experts as well, but just a quick sort of primer, right? Because part of this presentation is about, or sorry, a lot of this presentation is about lifestyle medicine, but a lot of the times we end up seeing a lot of people in pain. So um, the primer here is just to remind us that pain is an output. We can think of it sort of as an alarm system. Sometimes our alarm system gets a little sensitive. Sometimes it works, is overworking the right, or sorry, overworking and trying to so hard to keep you safe, right? And sometimes we can have these, as I said before, changes in the neuroanatomy, right? Where patients don't understand. Wait, you're saying this is in my head? No, I'm saying this is neurologic. Like some of your pain that you're experiencing is neurologic, right? I put the sensory homunculus over here um to sorry to um show that these sort of brain maps can be distorted or smudged, as I was talking about before, right? Meaning that the representation of your hand, your foot, or your trunk, if it's in pain for a longer period of time, maybe past tissue damage or chronic disease, right? Because just chronic diseases like lupus end up in sometimes a heightened immune response, which may result in the body attacking itself, right? Rheumatoid arthritis can do the same thing, right? And your body might be on high alert as a result of these things because this danger, quote unquote, is from within, right? We're not necessarily getting pain signals, we're getting messages, and it's up to our brain, our body to make decisions about how to keep us safe based on our neurosignature and unique experiences, right? So all of this, pain science plays into lifestyle medicine because lifestyle medicine uses the biopsychosocial model versus the biomedical model. So not just thinking about, oh, they just need better structure. And there's nothing wrong with that, right? For these, I use the example of chronic low back pain because oftentimes these clients they need better posture, but maybe what if they are afraid to lean back because something traumatic happened in their past, right? Um, Telling them to do that, or even thinking about it from a sort of a graded motor imagery perspective, might um, hurt them. Like the very thought of leaning back might hurt them, right? So we might need to um, understand their beliefs a little bit better we before we have them do things physically, and maybe just have them do things where maybe they're looking at something like the Recognize app for trying to understand or sorry, trying to go through some graded motor imagery or trying to fix what's going on cortically with either the sensory map or the motor map. Am I getting everybody on this right now?
Mm-hmm. Yep.
Okay. So some of the best evidence that we have for treating the low back is not only is it exercise, but I also added these other things as well, right? So the mindfulness, like we talked about at the beginning, um, that would be the MBSR and the cognitive behavioral therapy have both been shown to be affected. I added PRT in there. It's fairly new, but I'm sure as more studies come out, and especially the one or two that we have, right, from the folks up in Boulder, they're high quality studies with some really good outcomes. We just need more reproducibility. The MB SR and the CBT have decades of backings right now, so that's the reason why I put those at the forefront right now. But those have been shown to help reduce chronic low back pain as opposed to usual care. Usual care, you come in, you get medicine, maybe you just do regular PT, but not necessarily addressing some of the stress or other lifestyle related things that are going on, right? We know that sleep or not sleeping enough can increase sensitivity and pain up to around 50% in our patients with that are experiencing chronic low back pain. And of course, I mentioned this just because of my pain science background, but education about doing pacing and in particular walking can have these calming effects on people that are afraid to move, right? And may not know any other thing that may be helpful for them. What else would you all, well, sorry, what else do you all know that is evidence-based that we could probably add to this list?
There's something on, it's one of the PRT founders. I spoke with Eric about this, and he did some MedBridge classes, and he had a stat about the reduction of back pain and like the percentage of it with the PRT and possibly with manual therapy versus just like medication, and
Mhm.
then even physical therapy with medication. And like the reduction, like the difference was, it was astonishing. Like I need to look it up because I'm not doing it justice, but it really was wild because it was like if you, I want to say one of the controls or one of the treatment, the trials was just PRT. And it was like it was so much more likely to reduce pain than medication that it was like why are we just now the I don't think it was a randomized control trial. I don't know how much data they have on it yet, but it still was enough to be, or I'm sorry, it wasn't a meta-analysis, but it was like there was like randomized control trials on that statistic, and it was fascinating.
Yeah, I'm 100% confident it will be matching the other two probably in the next decade, if not sooner.
Yeah.
Yeah, I think too, the percentage of patients that we see in physical therapy is largely low back pain too, right? So this
Yeah.
evidence is huge that you bring to the table. And then thinking about the percentage of our clients that would benefit from this evidence and from putting in some lifestyle medicine and putting in some mindfulness, MBSR, all that type of stuff, like it's like 65-70% of our entire patient load is chronic low back pain. So it's huge to think about.
Mhm.
Yeah. And for some of those things, we're not necessarily going to be treating it as I said before. We're going to be part of a team trying to make sure that we manage this patient, like as a part of a village or something like that. Okay, so my presentation is essentially done. So now that we went through lifestyle medicine, um, what, how would we now treat this patient knowing what we know?
I think questions, like question, question, question. I think getting to the bottom of certain things is really important. So like a lot of things you brought up, like additional questions that we maybe wouldn't ask. So like the sleep, the, daily routine, the bedtime regimen. Like if you're on calls until 2, 3 in the morning, like are you scrolling before bed? Like certain things that we don't necessarily think about. We're just like, okay, they need more sleep. They're only getting 5 hours. I think approaching it more holistically, and then just questioning it to a greater degree than maybe what we're used to. Just kind of not just checking the box of, okay, they need to get more than 5, but really delving into it with a holistic approach on some of the topics that you had discussed.
Yeah.
I want to know how you would treat differently. Is that on the next slide? Do I need to switch? I want to know how you incorporate that lifestyle medicine into specific like a patient like this.
Um, I'll tell you, but I want to hear this is a discussion, so I want to hear what everybody has to say before I don't think my answer is right. Like the most correct thing. Like I have experience in this, but like it's only experience from the other parts of like doing research to understand how the other parts of like what we do or what the other client or sorry, what the client is going through, how that can help me figure out how to help them change some of their behaviors so that they prevent future injury or they help improve like their health span, right? That
Hmm.
being said,
I
what would you add, Kelly? I'm so sorry, Erica.
That's okay. Go for it, Kelly, if you got something.
Oh,
Otherwise, I got something if you want
I
me to
know. I
go.
want
Yeah.
to hear what you have because I
Yeah.
still am like, this is all new to me. So I'm still like processing, like, how do you incorporate
Yeah.
this in? It's fascinating.
Yeah, I mean, I guess the what I wanted to say is that I think a lot of clients that are going to come to us are still going to think traditionally as physical therapists that we're just going to be focusing on the muscles and bones of the body, right? Maybe the nerves, but they don't, a lot of people I don't think are educated to know that we do have the ability to treat these other aspects too and work as a big part of a team. So I think it's important to have a balance on, especially on that first day, to make sure that we're talking to them about these things and we're starting to paint the expectation or the picture of this is going to be, you know, a multifactorial approach, just so they have that expectation from day one, but also knowing you don't have to check every single box on day one, because that can also be really overwhelming. You don't have to have
Mm.
a full on discussion about sleep and about, you know, like diet and all these things on day one. You can get some good baseline information and you can do your objective test. And then, you know, starting with the education, a little bit of HEP with the motivational interviewing, like Brandon said, and then knowing later, like come in second visit while you're doing your manual or whatever you're doing, ask them about their diet, right? And like that's, I guess, how I would approach it. And definitely want to hear your approach too, Brandon, because we're all different. But I just wanted to say, I think it's important that we still build that evidence that the patient is going to expect in a way of making sure we're showing them we're addressing their physical symptoms, right, and making sure we're making a move, we're putting them through tests that we deem important so that we feel confident with our diagnosis as a PT, but also we need to get that buy-in and rapport with them too. So it's just about finding that balance. So knowing too that when you're implementing this lifestyle medicine, it sounds like it's a huge piece of the puzzle for these patients, like absolutely cannot be avoided, but know that we also need to do a little bit of our, you know, typical PT stuff as well, and finding a balance based on, you know, what that patient seems like they most need from us, if that makes sense.
I love that. And I think like
Does.
meeting them where they're at. Like you always say it best, Erica, like if they wanna like dump everything and that's where they're at and they you can't do as much in that first session as you want, like maybe it's more of a motivational interviewing and just questioning that first session and maybe it's not. But like really focusing on like where they're at in that day. Because I feel like, yeah, we tinker on like what's too much, what's not enough. Like we've had this conversation, Kelly, Brandon, and myself about the number of exercises we give them, you know? So it's like I think we always have to do like a scan of like what we're thinking we want to get through, but then also taking inventory of where they're at. Because like they may not be up for all of that, you know, in session one, like you said, Erica, or they may want to, you know, and it may be less, you know, hands-on that day just because they're not ready for that or they're nervous or they're scared and you just got to sit next to them and meet them where they're at.
Yeah, yeah, absolutely. I think one of the biggest questions we can ask, especially these patients, but any patient, is about their prior PT experience and knowing what they liked or didn't like out of that. And that right away, especially if you're new to implementing these types of other treatments and other, you know, subjective, objective questions with patients, that can tell you a lot about where they might be at on that day with you. Because if they're giving you all the things that their past PT didn't do, you know, like they never put hands on them, they never, you know, did this, they never this, then you know right away, like, okay, this is one thing I could do today that would make them feel like this could be something better. And some patients, at least in my experience, will say that, like, yeah, they never put hands on me or they never gave me any exercises. And some will say, like, I just feel like they never listened to what I was saying. And then you know right away, okay, this might be a day where maybe we ask them all about lifestyle medicine, right? And we talk about
Mhm.
that. And maybe it's a day where we're like, okay, they want some manual, like let's do that and just get that one thing in. And
Yeah,
yeah, and then work on implementing the rest of these, you know, lifestyle medicine questions when you can, to keep knowing more and more about them as you learn more about them in your next session.
that's great.
Do I get to flip the slide and see what you're going to
Yeah.
do?
Although this slide right here is just the general flow. It's essentially what we just talked about. I could
Okay.
tell you what I generally do.
Yeah, let's hear it.
Yeah.
So, um, my clinic set up probably a little bit different than most. I have like a fridge in there. I give them like water or still water or like cold water if they want it. And then um, I'll ask them like what they're grateful for, right? And we'll have a little discussion of that to build some rapport, right? If they're in a hurry, then we'll just get to the exam. But I'll explain to them how the exam typically is going to flow. So I'll say, "Hi, I'm Brandon. It's very nice to meet you. Um, we're going to go through a physical therapy exam today. We're going to go through this subjective exam, and I'm going to listen to you, and I'm going to um, help you figure out what's going on with you by listening to you, and I'm going to ask questions to try and get more information about how I can better serve you today. If I get through the exam, that part of the exam, and I can't necessarily help you, I will try and find somebody that can." And then explain what the objective exam is, how the assessment would be in terms of just like treatment options, right? So if I think that they need, um, let's say they have, as the before, a lot of cortical smudging, right? We built trust and everything, like they have a lot of cortical smudging. I'll maybe introduce them to the Recognize app for this person had low back pain for back, right? Or I might have them do a little bit of PRT or body scanning if that seemed more important to them, or I'll have them do. But the list can go on and on in terms of what I'll have them do. In terms of the lifestyle medicine aspect, I mostly will just use the coaching approach, right? So I'll ask them inquisitive questions to help them elicit sort of positive thought or thought about what's going on with them, because a lot of the times the clients or patients that come and see me that have had like trauma or they've just been in these high stress states, they're not aware enough to be in their as a support in their own body. So oftentimes they're ignoring what's happening, right? And sometimes we'll get through part of the exam and they'll start crying, or they'll need a moment, or they'll need a hug, and we'll just take a moment to breathe, and I'll ask them or give them a choice about what they want to do. Like I have, as before I have my TPS, so I have all of the why do you hurt, like analogy cards, and the ones about like the lion story and the sensitive nerves and ion channels and all the other stuff, right? Or just like basic pain neuroscience, right? And sometimes they'll like, why do I hurt, or what's going on with me? And even just having the conversation can help reduce their stress or their perception of what's going on with them, or help them come into their body. In terms of other lifestyle medicine things, treatment wise, I'll have them go through some, as is before, body scanning or some mindfulness, right, or some meditation. And I won't necessarily ask a lot about diet unless they bring it up or they're trying to recover, right? So I don't use all of these different things, but if my client is like, I have a client right now that is 400 pounds and she doesn't trust doctors. She's like I'm like the first doctor she's seen in like 2 or 3 years. And the last doctor told her that they wouldn't operate on her torn ACL because she was overweight and just wasn't listening to her, right? So she didn't seek out care and had some trauma as a result of that experience. So the first session, which with her I set up an hour and a half, I just spent time building rapport with her and doing all the things to help build trust, right? So it doesn't always have to look one way, but as you all said, it just, whatever you think they'll need, right? We have all these tools, so whatever you can to help build trust and get to a place where they feel like you can help them get better. That's what I do.
Yeah, well said.
So just for purposes of time, I think you have this six pillar on the next slide. Is that okay if
Yeah,
I
go
go
ahead.
ahead and kind of
Yeah,
look at that real quick?
sorry, I
Yeah.
know this wasn't a half an hour, but yeah, these six pillars. So these are different things that you can incorporate into PT. So now on the nutrition side, right, you can give general advice about, as I said before, protein timing, and general advice about um, recovery from surgery, right? We don't really touch on that very much, right? But we can say, like eating more protein in general is going to help you recover, assuming that you're having a perfectly balanced diet. Talk to your dietitian, right? The physical activity part, we're kings of that. We know how to do graded activity, graded exposure. The sleep part, we can interact with a lot, but it just really depends on what's going on with them. Usually sending them back to like some kind of sleep specialist that specializes in some kind of behavioral therapy, especially if they have insomnia. It's probably going to be effective for them, more effective to them than sleep hygiene if they have like some kind of sleeping disorder. On the stress management part of things, seeing a psychotherapist if they're not already seeing one, but also doing some mindfulness or some practicing of different like breathing practices and whatnot, and body scanning can help reduce that stress. Social connection, typically we will touch on this in terms of just like if they're depressed or if they're anxious, to make sure they have some kind of like support system. And as I said before, I see a lot of people that have gone through like drug abuse. So um, we can touch on that to see if they have some kind of some social support system, if they're getting the help that they need. So it's really about finding the resources that they need as PTs, since we interact with them a lot.
Yeah.
I gave an example of how that might look, um, how you can progress them over time. Not super important right now. We can go to the next slide.
I like this though. I always like the practical stuff.
Me too.
And then the stuff that I've been mentioning along the way, scope, team, referrals, it really is a team effort. We can't do everything in a silo. Um, if we see something, say something is what I always say when it comes to PT, because that just means the patient gets better, and you can build a team, you can build referrals, you can build a relationship with this human that's in front of you.
Yeah.
Love it.
Yeah, that's all I had. Um, Anything else y'all want to discuss? I know this ran a little later, but yeah.
It was great. I can't wait to like kind of dig in and do some research and see how to use some of the stuff. 'Cause just with, like I said, with Erica's pain science, it was a I've been trying to utilize some of those little techniques. And so this I think would just be that like next step. Like we talked about the pain science and the why we're doing the physical therapy, and then, how to like, I just feel like that's like the best next step would be the lifestyle medicine. So thank you so much for
I
putting all
agree.
this together.
This was great, Brandon. Thank you.
Yeah, I
Sure.
loved it.
And so do
Sure.
you offer like just for, because sometimes we do have patients that watch some of these webinars, which I think is great. Do you offer any coaching like just for lifestyle medicine? Is that something, one of your services that you offer right now?
Yeah, we found in the research that 12 months is really the best, gives the best results. And in the beginning, it's like meeting with them every week for like 45 minutes,
Mm-hmm.
45 minutes, right? And coaching them on and when I say coaching, it's really, you're not giving expert advice unless they ask for it, or unless you ask permission to give advice and they say yes. Like
Oh,
you're
interesting.
asking them, huh? Yeah, so you're like asking them like, um when was a time that you were successful with X, if they're struggling with like, let's say, weight loss, or struggling to stay outside. My children are squawking in the background. Or if they're trying to find success with something, right? So you can elicit positive emotions by asking them when they were successful with when they were successful another time in their life. You can ask them what was the best part of their day or the best part of their week to elicit more positive emotions. Um, you, it's really about asking those inquisitive questions and then reflecting, right? They give you this big summary about what's going on, right? And you could say, so I'm hearing that this, and this is happening. And you can add pauses in there, and they'll say, no, it wasn't this, it was this. But the idea behind that is, or the idea behind coaching is that you want to be able to help them build that self-determination, that self-efficacy, right? And you have your own personality, a little bit of zest, a little bit of that to to bring to it to act as an example of what they may want to be doing in the future. 6 months is also an acceptable amount of time, but oftentimes these intensive lifestyle medicine um, programs that I'll run with some of my clients do involve them having to put in the work, and sometimes they don't do well, and that's okay. We celebrate their wins, not their losses.
I love
That's
that.
great.
Yeah. Well, thank you so much, Brandon.
Of
So
course.
we'll have this available on our YouTube channel. So we're glad that people were able to stop and listen to this.